In the last 50 years, mankind's two most profound achievements have been in the areas of biomedicine and computer science. 50 years ago, a computer the size of a large room could add, subtract, multiply, and divide. Now, most of us wear more computing power than was available to carry the first manned mission to the moon and back. In a similar fashion, from both a diagnostic and a therapeutic perspective, progress in biology and medicine have been equally profound. While not obvious, it is now clear that these two fields, medicine and computer science, are converging. The Goodman Simulation Center in medicine is at the tip of this convergence. For more than a century, medical and surgical skills have been taught through an apprenticeship-like program involving graduated responsibility, but without the ability to actually practice or rehearse, except on the direct care of a patient.
So welcome to the Goodman Center. This is a simulation center for training physicians, healthcare professionals. It's operated by the Department of Surgery, and so our focus is on scenarios and training that happen in the operating room, although not exclusively so. What we have is a computerized robot mannequin that emulates many of the physiological conditions that you might find occurring during an operation. So he's made of plastic and metal, but he has certain features that imitate what happens to patients. He breathes, you can practice intubations, you can place IVs, you can place a chest tube for drainage, you can palpate pulses and do a variety of other maneuvers. You can defibrillate him, for example, or you can use an external pacemaker. What we do is create scenarios based on events that actually happen in hospitals, and then we bring in students with some Confederates who are part of our team, and we videotape what happens during surgical cases. Then afterwards we can take those students and do a debriefing to talk about what decisions they made, what happened, what other resources or what other choices were available to them. So it's a immersive learning process that is in a safe environment. We allow them to make mistakes. We allow them to do things that would be dangerous with real patients in order to get them up the learning curve, so the first time they actually have to do this for real, they're better prepared. So this plastic chest skin covering comes off, and underneath what you see are pneumatics and some plastic bladders that, as you intubate and ventilate this patient, we can determine what the airflow and volume is to determine if the patient is being ventilated adequately. Underneath here is a spring and a knob for chest compressions for practicing CPR. This small air bladder here, this pillow, is used to make the chest rise and fall, and we can control the respiratory rate as well as the depth. Underneath, these structures are used for generating heart sounds or lung sounds, so that when you use a stethoscope to listen to the patient, you get a realistic simulation of what you would normally hear from a patient. These bladders here can be used for a needle placement for decompressing a pneumothorax, as well as the skin here on the neck area can be used for a surgical airway. So that's some of the elements. This is a commercial product. It's available off the shelf from a vendor. We didn't design this particular one, but we use it extensively here in the Goodman Center. If you insert the tube too far, you will advance it into one of the main bronchi is one of the main branch into the airway, and you only get single lung ventilation, which is less than ideal. If it's not advanced past the vocal cords, you also won't get good ventilation. So there's some technique, and while you're placing the tube, it also obstructs the airway, so you only have a limited amount of time to successfully complete this maneuver. Otherwise, you need to remove the tube and go back to a mask and conventional ventilation.
What process is that for?
This is for doing an airway or placing an endotracheal tube to assist ventilation and breathing for the patient.
Bleeding, guys. Flat pad, please. Okay,
I'll get the aorta.
Guys, we have a lot of bleeding.
Give me a cross clamp, please.
Open up both IVs.
Come on, squeeze in the fluid, guys. Squeeze it in. Squeeze it in.
And I got the aorta
It's not slowing down. Another lap pad.
Put some pressure on it. Put some pressure
All
on
right, I
it.
got it. Keep going, guys. We have absolutely tons of blood pouring out. Come on,
paddles in. Where are the paddles? Come on.
Come on.
We're asystolic. Let's have some paddles in the room. Open here.
Guys,
Some chest paddles
come on.
now. This guy's dying now. Asystolic without pressure.
This guy's dead.
All right, let's hold it there. What's going on here? This is totally unacceptable.
I agree.
I thought we had this prepared for.
We were all set to.
Very unacceptable. We have failed. We need to practice this again. John, you agree? I agree.
Let's go from the top.
Let's reboot the system, please.
If these residents were training on an actual patient, he would have died. This illustrates the great advantage of the Goodman Simulation Center, where the surgical simulation enables residents to practice such high-risk procedures in a low-risk environment. This enabled us to try it too.
Where am I?
You're in the hospital, you're gonna be okay.
The last thing I remember, I was in the car.
I know, you had an accident, sir, but you'll be fine. We're taking care of everything.
Oh.
Is his breathing okay?
Aw, you'll feel better real soon. It's fine.
He's fine right now.
That's oxygen level.
Oh, his oxygen.
Okay, his oxygen's falling. Here you go. Okay, that's not doing anything.
His oxygen, okay.
So, we get it up to a little level so it gives me a buffer. Okay. And then, alrighty. No. Okay.
Oxygen levels really low.
Oh no. No. It's gonna be fine. It's gonna be fine.
He's barely breathing.
Come on. Don't die. Alright. Good job.
He's still at 76.
It's gonna keep going up.
He's
No,
dropping.
no,
He's
no.
dropping. He's at 60, 66, 63.
Okay, we're aborting mission. We're breathing for him. Okay, oxygen levels are going up. Rajan Patel is saving the patient. His heartbeat, that's more important. Okay, you go get the... Oh no, his heartbeat!
All clear.
There, he's got a heartbeat back. Got a heartbeat back. Okay, but he still needs oxygen, right? Okay. Okay. Get it up like to around 90. Okay. Okay, good. Let go. Are you filming?
Yeah, go.
And then this is to inflate the little seal, which also anchors the tube. Now he should be golden. Come on, Betty.
He's only the 96s.
That's good. We are live.